Hi, my name's Liz, and I'll be taking you through an in-service with the Puregraft Direct Harvest System with the Direct2 lid today. We'll start by talking about the Puregraft technology, then we'll talk about everything you'll need before your first case. We'll talk about how to set up the system, how to use it, how to extract your graft, and then we'll finish up by talking about some troubleshooting and some tips and tricks that you might find helpful before your first case. All right, let's get started. So Puregraft is a sterile, closed-system adipose filtration device. Puregraft filters out the unwanted components of the lipoaspirate like blood, lipid, tumescent fluid, leaving you with up to 97% pure fat for reinjection. Now the Puregraft devices come in a variety of sizes. The technology is exactly the same across all three sizes. They're just sized for different procedures. So the Puregraft 50, this is good for face and hand procedures. 250 is great for face and breast procedures. And then the Puregraft 850, which we're going to be focusing on today, this is good for your large volume breast and body cases. So as I mentioned, Puregraft filters out all the contaminants from the lipoaspirate, leaving you with up to 97% pure fat in your graft. This is higher than any other adipose filtration device on the market or any other technique that you could be using. So what that means clinically is that because there are fewer contaminants in your graft, you're going to see improved graft uptake and lower complication rates. The Puregraft system was also designed to be really easy and efficient to use. Especially with our direct harvest system. You harvest your lipoaspirate directly into this bag. It gets filtered, processed, and then you can extract it really easily. Because this is a flexible bag, it's kind of like squeezing toothpaste out of a toothpaste tube. It's just really easy to get that graft out of there. And then the final most important thing is safety. Because this is a completely closed, sterile, single-use device, it reduces your contamination risk, and it's been on the market for 15 years. We have a really great history of customer satisfaction and safety, so you can feel really good about using this device with your patients. So how does it work? Inside every Puregraft bag, there are two filters. There's the fine mesh filter and the coarse mesh filter. So the fine mesh filter, which I'll point out here, this is what actually traps the fat cells and allows all the other contaminants like the blood, water, lipid to pass right through. This coarse mesh here, this is just a spacer. It allows for better fluid flow and drainage out of the system. So I've cut away the film on this Puregraft 850 bag so you can kind of see this a little bit. The fine mesh filter is a little bit opaque. And this is what's trapping all of your fat. This guy is like a grid pattern. Up close it looks less opaque. This is just there for drainage. And you might be wondering why 74 microns. So that 74 micron filter is sized to capture all of your mature adipocytes. Mature adipocytes are usually around 100 to 150 microns in size, and they typically exist in clusters. So that 74 micron filter is going to trap all of those good fat cells and keep them right at the front of the bag. You're not going to lose any of that fat through the filter. And then all those contaminants, they just flow right out and go to drain. So as I mentioned, the technology is the exact same in all of the Puregraft bags. We'll start talking about the 50 because it's the simplest, so it's easy to talk about. You can see here, this is like a top-down view if you're looking at it from above. The tissue port is in front of that fine mesh filter, and the drain port is behind. So whenever you're pulling out of this drain port and draining the waste out of the bag, none of that fat is making it past the fine mesh filter. It's all staying trapped up here, and all you're doing is pulling out the contaminants. Now, if we look at the 250 or 850 bag, 250 has 3 ports, 850 has 4. Still, the drain is the only port that's behind that fine mesh filter. You could use any of these other ports to access the graft, and all that's coming out of that drain is your contaminants. We've gotten some feedback, or we've heard from people in the field saying, oh, I saw this yellow fluid coming out of the drain and I thought that I was losing fat. You can see here, because that drain tube is behind, you can see it there, it's behind the fine mesh filter, you're not going to get any fat getting past that. What that probably was, that yellow colored fluid, is probably just lipid draining away, and that's not something that you want in your graft. All right, so now we'll get into the direct harvest system. We'll talk about what you'll need, we'll talk about how to use it, and then how to clean it up, and go through some little troubleshooting tips. So this slide just shows a checklist of everything that you'll get when you order your kits from Puregraft. The PG850 system, that's the disposable filtration system. That's really the heart of the system where all the filtration and all that good stuff is happening. The direct harvest system is just a tool to help get your fat into this bag and pre-drain it and everything, but all of the important steps, they're all happening right inside here. So when you order a Puregraft 850 kit, it'll come in a box that looks like this, and you will get the Puregraft 850 bag, you'll get a drain bag, and you'll get 2 disposable combined adapters. Now for the reusable kit, when you order the direct harvest system, you will get this Direct2 lid, and that comes with these 2 pieces here. It's all one thing. The drain lever, the drain straw, and the lid. You will also get the instrument set, which is a easel for holding the bag, and a slider that helps you slide the fat right on out of there. You'll get the reusable 3-liter canister that holds the lid and holds the bag. And then you'll also get a reusable combined adapter. Now the reason I have this highlighted as optional is that you get 2 disposable combined adapters in every single Puregraft 850 kit. So if you lose the reusable adapter or it doesn't get sterilized, it's not the end of the world. You could just use those disposable ones, but when you order the direct harvest kit, you're going to get all that stuff that's on the screen here. So now we'll talk about the items that are not provided by Puregraft that will need to be provided by you or your facility. You're going to need a harvest cannula. Now we recommend a 3 or a 4 millimeter cannula for harvesting. If you use something larger than that, it's going to be bigger clumps of fat tissue that are prone to getting stuck inside the tissue port when you're trying to extract your graft. So it's just easier if you use a 3 to 4 millimeter harvest cannula. You will need a liposuction machine or another suction source. You will need tubing to connect to the suction source and to your suction handpiece. So before your first case, I'd recommend just trialing the tubing and making sure it fits on this lid. These ports are tapered, so most tubing should fit, but you just want to make sure before you get to the room that everything's going to work. You'll also want to check the tubing lengths and make sure that you can set up the Puregraft system inside your current surgical setup without having to toggle things around and move things. You're going to need lactated ringer solution for washing. You can also use normal saline solution, but we recommend lactated ringers. You're going to need syringes. You will need catheter tip syringes. Looks like that, if you're not familiar. And you'll need lower lock syringes. And then finally, you'll need your injection cannula. Okay, so now we'll start with step 0. We don't start with step 1, we start with step 0. And that is ensuring that you have everything that you need inside your OR and ready to go. First thing you're going to want to check is that your direct harvest system is sterilized and that all of the parts are in the tray. There are a number of parts here, 3 parts on the lid, 3 pieces to the instrument set and the canister. Just make sure that everything's in there. You'll need lactated ringers or saline solution, whatever you're going to wash with. You'll also need a lure lock syringe or irrigation tubing to connect to the bag for the washing step. You'll need your tubing and your liposuction machine or vacuum source. You'll need the Puregraft 850 kit. It's always good to have a backup one of these just in case, or if you have a really big case and you need a ton of volume, then you're going to want 2 of these. And then the last thing that you'll do is do a visual check of the direct harvest system. So make sure that there's no cracks in that canister. That's not something you're going to see right off the bat. That's something you might see after a couple hundred reprocessing cycles, but make sure there's no cracks. Make sure the O-rings are intact. There's a O-ring on the bottom of this lid. Then there's a couple of O-rings each on these accessories. Just make sure those still look good. And then the last thing that you're going to check is that there's no visible damage to either of these connection ports. Say it got dropped and something chipped. This is made out of aluminum, so it's not likely that that's going to happen, but just make sure. Make sure these 2 ports are intact and that there's no damage to this straw, that it didn't get bent or pulled on or anything like that. Once you've done that, then you're ready to start setting up the system to begin harvesting. Okay, so the first thing that you are going to do is assemble your easel. So the easel is 2 pieces here. It just goes together like this, slides into place. Set that down. Then we'll take the canister and slide it there into place. So now it's all set. So one thing to note is that these pieces don't really lock into place. I would recommend setting this all up in the place that you're going to want it during the surgery. If you do have to move this after you've set it up, just make sure you have enough hands on it. Grab both pieces here, grab the canister, because you don't want to drop any of this. Once it's already sterile, you're going to have to start all over. For the next part, we're going to move on to the Puregraft 850 bag. So, open up the box here. I've already opened the sterile packaging, so we don't have that stuff. So we have the Puregraft 850 bag here. You are going to remove these aux and drain caps, but don't throw them away. Good rule of thumb with Puregraft is do not throw anything away until the end of the procedure. So we will just take these off. We're going to set them aside with the drain bag and combined adapter that came with the Puregraft 850 kit, because we'll need all of that at the same time. So now let's look at all these connection points on the top of the lid. It's difficult to see here, but you could see it really nicely in that picture. There are kind of cutouts on the lid for where the drain lever and the drain straw go. So it's really easy to tell how to assemble all of this. So let's go ahead and take the drain lever, just insert it in like that. We'll take the drain straw, push that guy in. Now flip the lid over and you'll see that just like the top of the lid, the bottom of the lid calls out all the connection points that you're going to need with the Puregraft bag. So there's a call out for the tissue port. The wash port doesn't connect anything, but there is a little circle there that just shows you where it goes. The drain port is called out, and then the aux port is called out. We even say remove the aux cap. It's etched right onto the lid because that is an important piece. If you don't remove the aux cap, or at risk of bursting the bag, and the bag's not really going to fit in the lid and in the canister if you remove the aux cap, so that's another good check. So now we're going to carefully insert this straw into the Puregraft bag. Just be careful that you don't puncture the bag. This isn't sharp, but it's a metal object and this is a plastic bag. So I'm just going to set it down. And it's easiest, so this, can't see it here, but this is completely flat with this drain straw attached. So you can just set it down on your workspace on the sterile field. We're going to slide the drain straw into the drain port. And this is just a screw connection. It's a large bore lure. Just screw the knob so that this is all connected here. Next, you'll connect the gold tissue port to the tissue port on the lid. Just press that in. That's a friction fit. You might need to rotate this a little bit, one way or the other, just to make sure that this all lines up really nicely. Now, we'll flip the lid back over and just make sure that these O-rings are fully seated in the lid. So you should be able to see just like a tiny glimpse of the O-ring, and that means that it's fully seated. So now we'll roll this bag like a taco or like a hot dog bun, however you want to say it. And we will slide it into the canister. Just like that. Something to note with this lid, take it off the easel to show you this. This is not going to feel like totally locked on to the canister. See, it's like, it's not loose, but it's not tight. It's not going to feel totally locked in until you turn your suction source on. Then once that vacuum's applied, it's going to suck right onto here. And the reasoning for that is that if this was totally tight on here, at the end of your procedure, after you've harvested and everything, it would have been really hard to pull this lid off the canister. So the reason it's not totally like squished in there, that is just to make things easier at the end of the process. Don't worry, once the suction's on, it's going to be completely secure. Just, again, if you have to move this guy once it's already assembled, make sure you hold it upright. It's always good to have a couple of hands on it. Just don't hold it like that because it'll topple. All right, so I'm going to set the easel aside here just for a second because we don't need it for this part. In real life, you'd have this locked onto the easel, but just for ease of showing you this, I'm going to move it to the side. We are going to attach our tubing to the top of the lid. So there's a call out for the patient tubing and a call out for the vacuum tubing, so you know where everything goes. The patient tubing just connects right here, and that goes to your suction handpiece. The vacuum tubing goes right here, and that goes to your suction tower, your vacuum source, whatever setup you have. All right, so now we're ready to begin harvesting into the Puregraft bag. All right, so I've kind of reset things here. The easel is here, the lid and the canister assembly are here, and I've rotated this towards you so you could see these volume markings a little bit in the bag. Here, I could probably rotate this a little better. There we go. So once you turn the suction on and begin the procedure, lipoaspirate is going to start flowing directly into the Puregraft bag. It'll come through this tube here. The design of this drain straw allows you to pre-drain the contaminants out of the lipoaspirate. It's a really cool design. So the amount of pre-draining is controlled by this lever here, which you can't see in this view, but we'll see it on the next slide. So to adjust that pre-draining level, you're just going to rotate this drain lever. I'll probably show you this a little better here. You're going to rotate this drain lever to either the max fluid drain if you want it to drain really fast, or towards the other side if you don't want too much pre-draining. When you're changing that pre-drain level, a higher pre-drain level is going to result in a slower suction speed. So if you have this guy all the way up towards max fluid drain, suction's not going to be happening as fast. If you have it all the way the other side, you're probably not going to be draining much, if at all. So you could just adjust it and find the point that is your preference. I would recommend at the end of harvest, or when your surgeon's switching sides, that you take this lever and crank it all the way up to max fluid drain. It's just a good opportunity during a break or at the end of harvest before you pull the bag out to get as much fluid as you can out of this system. And you will see this level kind of go down as you're draining. When you're done harvesting and when you're done draining, go ahead and turn off your suction and you're done with this step. Oh, something to note. The maximum fill of this bag is 1,275 milliliters. You should never exceed that volume in the bag. If you do, you're at risk of fluid spilling out the aux port, or in an absolute worst case scenario, you can cause this bag to burst within the canister, and then it's going to be really difficult to continue the process. So just keep an eye on this scale while you're harvesting. This is an approximate volume that'll show you about how much you have in the bag, and keep it below 1275. If you're starting to get high, you can go ahead and pre-drain. That'll help you make a little more room in the bag, but make sure you're keeping an eye on that maximum. And if you want to estimate the total amount of final graft that you're going to get, a good way to estimate that is about 40 to 60% of what's harvested into the bag. It can vary based on surgical technique and washing, but it's a good rule of thumb. All right, now we're ready to wash. So we're going to get back our aux cap and our drain bag that we set aside earlier. I have the caps here. And then our drain bag here. Now we are going to lift this lid very slightly from the canister. It's going to be heavier than it looks because it's going to be full of fluid. Leaving this bag in the canister, go ahead and unscrew the drain straw. So you'll hold on to this drain cap here, just unscrew this lever, and then you could go ahead and pull that out. Then we will disconnect the tissue port. Now we could go ahead and remove this lid and set it aside. We're all done with it. While the bag is still in the canister, reattach that aux cap, this guy, and attach the drain bag tubing to the drain port. It helps actually if you pre-twist this the opposite way and then twist it in. It just makes it a little easier. There's a pro tip. And the reason that we say to keep the bag in the canister while you're reattaching the port cap and the drain bag is that at this point, these ports are open. There's no valve in there. If you were to squeeze the bag or tilt it over, you could get either waste fluid or lipoaspirate flowing out of either one of these ports. It's just going to be a little messy, so keep the bag in here until these are securely attached. Now we're going to pull the bag out and hang it on the easel. and then drop the drain bag to the floor. Now I'll rearrange this here so you can see it a little better. We're done with the canister. I'll spin this one. Oops. See, that's why I say keep 2 hands on it if you're going to move it, because it can slide apart. All right. So you can see that it's on the easel. Now there are 3 hooks here, 1, 2, 3, that you can use to hang the Puregraft bag. I usually just do the outer 2. You don't really need the 3rd one, but you can hook it up if you want. All right, so we have the easel, we have the bag in place, and we have the drain bag on the floor. Now, if this clamp is not already open, go ahead and open it and let any remaining fluid that was in this bag just flow on out. Once that fluid stops draining and you see no more fluid flow, no more drips in this tube, you can go ahead and close the clamp and begin washing. You add your wash fluid through this wash port here. It is a lure activated port, so you can either use a lure lock syringe, or if you have irrigation tubing that has a lure lock connection on the end, you can use that. The irrigation tubing is probably going to be a little bit easier and less manual, but either way, you can use either technique to fill the bag with your lactated ringers or saline solution, whatever you're using. You can also wash through the tissue port if you wanted to, but the wash port is there for you. The wash volume that you add to the bag, it should be about 50% of the volume of tissue that you have in here. So if you have 600 mils of tissue, go ahead and add 300 mils of washing fluid. Then once you're full of your fluid, you're going to go ahead and mix the bag, give it a little massage. You can lift it up. Just make sure that you're mixing all of that tissue with your washing fluid. Once you've done that, go ahead and open the drain clamp, and you'll see all of that fluid just whoosh, wash right out of the system. The drain clamp should be open for about 2 to 6 minutes. This will depend on how much wash fluid and volume you have in the bag. If you're at the lower end of the volume of the bag, it might take 2 minutes or less. If you're completely maxed out, you might be waiting here for 6 minutes until this stops draining. Either way, once that fluid flow stops, go ahead and close this. And then you're going to go ahead and repeat that process for a total of 2 washes. We recommend 2 washes. That's what we recommend per our process, but this is going to depend based on your preference. Some people are really happy with the tissue quality after 1 wash. Other people might even want to do 3, but it's up to you. When you are done washing, the tissue should look like this picture here on the right. It should be a really nice golden Puregraft yellow color. And once you have that golden yellow fat, it's time to extract the graft from the bag and transfer it to your syringes for injection. So we're going to grab that catheter tip syringe and our Puregraft slider. This is the 3rd piece in the instrument set. It'll come in the box with this easel. So insert this catheter tip syringe into the tissue port, and then use the slider to push all that nice tissue down into your syringe. You're probably going to need 2 people to do this. It's kind of hard to pull on the syringe and push down on the bag at the same time. You might be able to do it. I don't know. I can't do it. So I would need a 2nd person. One thing you want to watch, make sure that your drain clamp is closed when you're extracting the graft. Otherwise, you're just going to get the fluid that you just drained back into the bag, and you'll have to repeat your draining step. So make sure that that's closed, and then just go ahead and extract your graft. You can also get the graft out of the wash port here or the aux port. The washport's going to be a little bit difficult because it is a smaller diameter connection, so it's not going to come out as easily. The aux port, so there's no valve in this port, it's just a large bore lure connection. So the advantage is if you have some like clumpy or fibrous fat, it might be easier to get it through this port. The disadvantage, you probably don't have something in your setup that you can use to connect to this. So you're going to have to figure out a way to catch that fat. I would save this aux port for like a in case of emergency or a backup, unless you have a specific setup that you like to use that connects to this aux port. Something that you might see while you're extracting is that there might be a little bit of fluid in this tissue port. It'll pool right here at the bottom of the tube. That's just wash fluid that got stuck in this little port because it's lower on the bag. If you see that, just take your syringe, extract, and discard that fluid, and then continue extracting the graft. This fluid is just the stuff that you drained out. You don't want that in your graft. And then once you have pulled all of your graft into these catheter tip syringes, you're going to use the combined adapter to transfer from these big guys into your lower lock syringes for injection. So as I mentioned before, there are two different combined adapters. There is this reusable one that comes with your direct harvest kit. Or there's the disposable one that comes in your Puregraft 850 kit. That looks like that. They are the same design, just different materials. One's reusable, one's not. It's up to you what you want to use. We'll use this guy because it's a little easier to see on the video. So you'll take your catheter tip syringe that's full of your graft, insert it into the combined adapter, and then connect a lower lock syringe onto the lower lock tip here. Screw that in, and then you'll just push this through and transfer the graft into that syringe. Something that you want to watch out for. This is not locked here. The lower lock syringe is locked because it's a threaded connection. This is just a slip friction fit. If you are really forceful with your syringe pushing and you push real hard, you can shoot this guy off into space. It goes who knows where, and then everyone in the OR got a fat shower and you lost your combined adapter. It's definitely happened before. So just be careful and make sure you keep two hands on these, or you can kind of hold it with one hand and use the other hand to push. Make sure that you are not at risk of losing this guy. All right, now that was the fun stuff. We'll just quickly cover disposal and cleanup, and then we'll get into those troubleshooting tips. So everything that came in this Puregraft box is disposable. You can go ahead and dispose of that in accordance with your facility's medical waste policies. Then for the reusable components, you're going to disassemble the canister from the instrument set, and then go ahead and disassemble that instrument set. You are going to take the drain straw and the drain lever out of the lid. Leave these O-rings intact. Don't pull them out of the lid or the drain lever or the straw. Immediately remove any rough surface soilings that you see using a disposable cloth or a paper towel. You're going to want to do this at the point of use. If this stuff gets dried on here, it gets more difficult to clean. And now each of these components of the direct harvest kit have their own instructions for use. So there's one for the lid, there's one for the instrument set, which includes the easel and slider, there's another for the canister, and there's one for this combined adapter. Each of these components has cleaning and sterilization instructions in their IFU. You're going to want to make sure that whoever is responsible for reprocessing the devices has read and completely understands those instructions for use. We do provide a sterilization guide and a reprocessing guide that kind of helps walk you through everything at a high level, but whoever is responsible for reprocessing at your facility, they need to have access to and totally understand that IFU. It's just for everyone's safety. And then once you have everything separated, make sure that cleaning process begins within 3 hours after use. If you get, again, any dried on soil, it becomes more difficult to clean. The cleaning process becomes less effective. All right, so that was the process. Now we'll just go into some clinical pearls that we've collected over the years. These are just best practices and troubleshooting tips that you might find useful before your first case. So let's go to the first symptom. What if the bag doesn't fit in the lid or the canister? First reason for that could be that your bag was not rolled before it was inserted. If you don't roll it, it can get caught on the sides of the canister and get all crumpled up. Just pull it out, re-roll it, and insert it. Another reason could be that the aux cap was not removed. If you don't remove this cap, the bag's going to sit really awkwardly inside the lid. So just go ahead and make sure you've removed that aux cap. Next symptom is that maybe your suction's not working. This could be for a few reasons. So it could be that the O-rings are not fully seated. Either this canister lid is not all the way in the canister, or the drain straw or drain lever are not all the way in this guy. If that's the case, just wiggle things around, push them down, make sure everything's fully inserted. Could be that your tubing's not properly connected, or that there's a kink in the tubing. Check that. Could be that you're missing the drain lever. That's actually not on here, but that's something that could happen. If you didn't put the drain lever in here, you're going to have a big gaping hole in this lid. Your suction's not going to work. Then the last thing could be just a suction tower issue. Either something's not set up properly or something's not on. I know this is probably common knowledge for you, but when you're using a new system, sometimes it's stressful, hectic, you forget these things, so it's just something to check. All right, the next symptom, waste not draining from your bag during the harvest. So we talked about that nice pre-draining capability that this lid has. One of the reasons that that could be happening is if that bag is folded really awkwardly. So you may have seen how the drain straw sits here, there. If this bag is folded up or something, there might be some fluid that's not able to be accessed by the straw, and then you're not going to get good draining. Another thing that could be happening is that your drain lever is not adjusted properly. Just make sure you adjust that until you get the draining level that you want. Could be that there's not enough fluid in the bag to drain yet. It's not going to start draining immediately. Once you have enough tissue in that bag and fluid contaminants are starting to pass through the filter, that's when you'll start to see the draining happening. The other thing that it could be, another silly one, is that maybe the surgeon turned off suction at the handpiece. And I've actually seen this happen before. So something that we maybe recommend is, okay, when the surgeon is switching sides, go ahead and crank that lever to max fluid drain to get all the fluid out. Your surgeon is probably not used to, or maybe his or her current practice is just to turn off that suction handpiece when they're switching sides. If that's off, you're not going to be draining, so just ask your surgeon to turn the suction back on and you should see everything drain right out. All right, now this next issue is something that you could see during washing. What if the tissue in your bag is still really red or pink? Probably just need more washes. Sometimes you might find you need more washes than normal on a given day. Just give it another wash and give it a good mix, and you should start to see that tissue. Once you drain, it should turn that nice golden color. Next thing that could happen during the washing step is that your draining is really slow or the bag seems clogged. First thing that could happen would be a wrinkle in the bag. So just go ahead and smooth that out. Gently massage the bag, lift it up. You should see draining happening. Another thing could be kinked drain bag tubing. If it got caught on something or somehow was kinked, just clear that out and that should help. One thing that is going to be a little more difficult to solve is that if your bag was overfilled past the max capacity, there's only so much surface area for this filter in the bag. If you're overfilling it, it is going to drain a little bit slower. Something that you can do to try and fix that once you're in your washing and draining step is just lifting that bag up or turning it horizontal to make sure that you're accessing the full filter surface area that we have here. But if you overfill it, you're just probably going to need to give it more time. The last thing that could happen, this would probably happen towards the end of your washing and draining steps, is if the bag suctions onto this drain tube stub here, kind of like if you have a Capri Sun pouch and it like wrinkles up. It could be that the bag film just got suctioned onto the tube here. Just pull that off and you should see it start to drain again. But if you reach that point, your tissue is already pretty dry, I would guess, so you're probably pretty close to being done with draining. Next thing that we can see, graft being hard to extract. One reason for that could be fibrous tissue. If a patient has really fibrous tissue, it's just going to be a little bit harder to get it out here. You can try adding a little bit of lactated ringers or air to flush the port. You could also try accessing the graft through the wash port or the aux port. Could be that you use too large of a harvest cannula size. Again, that's going to cause some clogging here. These ports are only so big. If you have big chunks of fat, it can sometimes get stuck. Try the same thing as if you had the fibrous tissue. Try flushing with lactated ringers or air or going through a different port. Last thing that could be happening here would be that you have over-drained your tissue and it's just way too dry. So maybe you left the bag to drain for a while and come back and it's just really, really dry. Just add a little bit of lactated ringers and that should help you to get the graft out a little better. Add a little fluid, mix it up, it should come right out. That's an easy fix. So the last thing that you could see would be low yield. The cause of this is usually just low harvest volume. This is something that you will just become more and more practiced with the more you use the Puregraft system. You always want to harvest a little bit more than you think you need. And again, a good way to estimate is to look at the amount that's in the bag and estimate that you'll get about 40 to 60% of that as your final graft. And the more you use the system, the easier it'll be to gauge this based on your technique and your processes. But if you wind up with low yield and you find yourself needing more, you can just grab another Puregraft 850 bag and pop that in the direct harvest system and liposuction into that. That's really all you can do for low yield. And then just next time, harvest a little more than you think you need. All right, so that was everything that I had for you today. I hope this video has been helpful. Thank you for your time and your attention. If you find yourself needing additional help, you can scan the QR code that's on the lid here, and that'll take you to a website with additional troubleshooting tips and videos, some in-depth guides that you could use as a reference. You can always call customer service. They'll be able to help you or connect you with someone who can. Or you can reach out to your dedicated Puregraft rep. They will be happy to help you. All right, thank you so much for watching and listening today. I hope you are excited to use this system. I hope you really enjoy it, and thank you for being a Puregraft customer. Bye.